Sleep apnea is the medical condition of interrupted breathing during sleep. It is normal for everyone as they toss and turn during sleep to hold their breath from time to time, or, in particularly men, to snore. However, when the number of breathing episodes become greater than what we consider normal, that begins to have a negative effect on the quality of sleep and other factors. So sleep apnea interrupts breathing. It leads to reduction in airflow, therefore your oxygen levels drop, which is not good. Your heart doesn't like that. Your heart will squeeze harder if during sleep blood oxygen levels drop frequently. This can lead to side effects of hypertension. And also during interrupted sleep, the phases of sleep become interrupted. We all know about phases of sleep. There's phase 1, 2, 3, 4, as well as REM sleep. During sleep apnea, those routine or normal phases of sleep are interrupted, and frequent interruption leads to unrefreshed sleep. So patients, when they wake up, if they have apnea, they just don't feel well rested. And that leads to side effects of poor sleep quality, sleepiness during the day, lack of attention, lack of energy. These are signs and symptoms that we see with sleep apnea. So sleep apnea is diagnosed by a sleep study. Yes, we get studies, but we first take a history. We ask the patient, or more frequently the spouse, are you a heavy snorer? Do you stop breathing at night? Those are signs and symptoms that would prompt us to order a test. So a sleep study is just that. It's a test done during sleep. Sleep studies can be done in two manners. One is a home sleep study. Another is a study that can be done in a sleep laboratory. Both tests essentially measure breathing. They measure pauses. They measure how long one holds their breath, and they measure blood oxygen levels. And these are all gives us a bunch of information, and we come up with a diagnosis. Actually, it's a single number that helps us decide, do you have significant sleep apnea or not? So the indications for sleep apnea testing include obesity, hypertension, enlarged neck circumference. Believe it or not, neck size larger than 17 is a high risk factor for apnea. History of stroke, heart disease, and of course morning headaches, poor sleep quality, and chronic fatigue. So in general, the first line of treatment for the vast majority of patients will be CPAP. CPAP or AutoPAP, which is a simple variation of CPAP, stands for continuous positive airway pressure. Continuous positive airway pressure is delivered by a mask, which is hooked up to a small hose to a small machine, which generates positive airway pressure. So every time when the machine is placed at night, every breath one takes, positive airway pressure is delivered, and that opens up your breathing. So that stops the blockage. So instead of collapsing in the back of the throat or the tongue, every breath that's inhaled, it pushes air in the back of the throat and opens up the breathing passage. CPAP is highly effective in treating sleep apnea. The problem with CPAP is compliance. Many patients, in fact up to 50% in some studies, after several months, just don't use the device, even though we urge them to use it. The device at times is uncomfortable, the mask is irritating, the patients with insomnia don't tolerate it well, some patients just don't like it. And if that's the case, we can try to refit the mask, we can try different pressures, but sometimes masks are just not the answer. Other options instead of the mask devices are the following. One is an oral appliance. An oral appliance is a mouthpiece that is generally custom made by a dentist. The device holds the lower jaw forward during sleep, which helps to prevent the base of the tongue falling back in the throat, which can cause the obstruction. That's called an oral appliance. Unfortunately, compliance, that is how many patients tolerate those, is less than 50%. The next consideration would be surgical options. There are in the right patient, surgical options that can be effective, if not curative, for sleep apnea. These include tonsillectomy. Many patients with enlarged tonsils, if we get those tonsils out, they're cured. Some patients have enlarged tonsils plus a large uvula, that is that thing that hangs down the back of the throat, in association with a long palate. There is a procedure, a surgical procedure, which actually removes the tonsils and trims the edge of the soft palate and shortening the uvula. This surgery can be very effective in the right patient. Another area of obstruction, which is very common for sleep apnea, is the base of the tongue or the back of the tongue. During sleep, the back of the tongue or base of the tongue may fall back and obstruct or partially obstruct the breathing passage. So there are some surgical procedures which can be done which reduce or prevent the base of the tongue from falling into the back of the throat and causing obstruction.